Thank you all for joining us on our webinar today. We are going to give everybody about 3 more minutes before we begin. Thank you for your patience. We're going to give everybody just 1 more minute before we begin. Thank you everyone for joining us today. This is Cindy Fry with Insurance Agency Marketing. Jeff Paula with Pinnacle will be joining us as well. We are going to go over the COVID-19 and selling Medicare remotely. Jeff Paula with Pinnacle, like I said, he is going to go through the online tools that we have available to do business remotely. At this time, I ask that if you have any questions, to please use the chat function and we will get those answered as we go through it. At this time, I will go ahead and switch this over to Jeff for his presentation. Thank you. Jeff, there you go.
Okay, I think we got it.
Yeah.
There we go. Okay. Thanks, everybody, for jumping on. As Cindy said, my name is Jeff Pallo. I work at Pinnacle Financial. We partner with insurance agency marketing on the Medicare side of things. So you have full access to everything that they offer, as well as everything that we're able to offer you for the Medicare products. Obviously, with everything that's going on here the last few weeks, we've been getting more and more questions about how you're supposed to still be able to get in front of people and make sales. Fortunately, we had the system set up and in place that we've been using now for a couple of years that allows you to do sales by email or over the phone. Okay, I'm going to cover a couple of different things on this. Really, one of them is how you can quote and see the benefits of the plans easy, and then also how you can do the enrollments and the full quoting, including the drug costs while talking to somebody, and then how you can actually do the enrollment while you're speaking to them over the phone. Okay? So first thing I wanted to show you is the quoting tool itself. So this is called the CSG quoting system. This is the one that Pinnacle offers, but you also get this through IAMS. So if you go to their website, it's their Medicare quoting tool. It'll look exactly like this, just with their logo and branding on it. So the difference really between the CSG system and the Connect for Medicare enrollment system is one is showing you the benefits of the plans and everything that's available in that area, which is the CSG that we're looking at. The Connect for Medicare allows you to enroll people, and because of that, you can only see the companies that you're actually contracted and appointed to sell. Okay? So CSG is good because you can see some of the other companies maybe that you don't have yet if you want to check out some of the other Advantage plans or supplement rates there. Okay? And it also has an easier way really for you to be able to look at a comparison. But the Connect for Medicare really is where you would do that physical application when you're speaking to somebody over the phone. So within CSG, you have multiple different types of products you can offer. For the sake of what we're doing right now, I'm going to show you the Medicare supplement and the Advantage plans. All you have to do is click Run Quote, and then you're going to put in the zip code. I'm just going to use our local one here. Age, gender, tobacco, non-tobacco, and then the plan that you want. Okay, I'm going to switch it to Plan G. One thing I like to point out to people is make sure you change this effective date to what you really want it to be. It'll be more accurate, number one, but also you're not quite sure maybe when the companies are doing their rate changes during the year. So if you put it to where your actual application is going to be submitted for, it'll be the most accurate rate at that time. So we're going to hit Get Quote. Anything you do within the CSG quoting system won't be saved for later. So this is not something that's going to save any of your client's information. You're going to go in, and each time you use it, it'll be a separate new quote that you're looking at, okay? So once you put that information in, it's going to automatically list everything in price order by monthly price, okay? If you want to see the annual rate over here on the left-hand side, you can click to annual rate, okay? If you know somebody is applying with their spouse or somebody else that lives in their household and they're going to apply with them, you can see the household discount underneath the pricing. And if you want to sort it by the household discount, on the left-hand side here, you can click Apply Discounts, and it'll reset everything for you. The reason why I wanted to show you that is exactly what happened here. Okay, this Ascendo plan, the CVS company, showed up at the top rather than down pretty significantly farther if you look at it without the discount. We've been getting a lot of questions on this lately. The CVS emails, the CVS MedSup emails have been going out from everybody. If you're contracted with Aetna supplemental benefits, you already have access to that. It was added to your portfolio. You could sell it right now if you wanted to. The big thing with that plan is that it's specifically built for those that have a household, somebody within their household they're going to be applying with. You can see that discount is pretty substantially higher than some of the other ones, right, at 14%. Right? When you go up to the top here, you see 7 is usually right where people are. Okay. Now, if you want to look at the same type of plan next to each other, so MedSup versus MedSup, as opposed to supplement versus Advantage, you would click the company's name. It's going to turn the color green, and it's going to move over into the Compare Quote section. So you can do up to 4 really this way, and you can see as you do that, it's going to move it over to the side. Okay, and if you wanted to see a MedSup versus an Advantage and a PDP, you can do that. But instead of clicking the company name, this little checkbox here on the right-hand side, the little globe, you would select that, and it would turn purple, as opposed to green, and it moves into the universal compare section. So that would be really where you're showing someone an advantage versus a supplement and a PDP together, okay? If you wanted to send them multiple carriers, we're going to select 3 of the bigger companies, okay? Then you're going to click compare quotes. And it'll show them side by side, okay? The nice thing on the supplements, because a Plan G is a Plan G with everybody for the same benefits, when you do this comparison to send to somebody, if you print it or save it as a PDF, which you can do by clicking either of these buttons, you can add the Medicare benefits to the quote. It'll automatically download for you. And then when you send this, you see it has the rates and everything that you wanted to send them, but it also has all of the benefits, for the most part, that are covered by Medicare, what Medicare is paying, what the plan is responsible for paying, and then what the client is responsible for paying. So it's just a nice, quick, easy way to get something out to your clients so they can see relatively what they're responsible for.
Jeff, on that note, can you go over what that effective
Sure.
date is there on the plans?
Sure.
Because a lot of people think that's the date their application is going to be effective and come back and say, hey, we needed it for this year. So if you could just explain what that effective date is, I'd appreciate it.
Sure. Good point. So the effective date within the quote itself, which you see at the bottom of each of these, that's the rate, that's the date that group of ratings went into effect. So that was when they first put out the rates for that plan in that state. Okay, so what that would mean is for Transamerica, let's say, they're going to be due for a rate increase here coming up in May. So that's where that comes into play there. It's a good point, Cindy. Okay, so if you want to jump back into the quote, you can simply hit the back button there at any time. One other thing I like to show people here is over on the left-hand side under Market Analytics. If you select that, it'll show you some of the recent rate increase history of the different companies. Right? It'll also show you the market data, how many people they have on the books and premium and whatnot. So it's just a little bit of extra information that'll help you when speaking to your client sound a little bit more knowledgeable. Okay. So for the supplements, it's pretty straightforward. If you wanted to show an F, a G, and an N, let's say, you could do that. So if you know that you want to offer Aetna, let's say, you can go to a Plan G, select Aetna, move into the comparison section, change it over to an F. It'll automatically resort everything for you. Select the F plan, and then change it to a Plan N. And select the Plan N, right? So then you can go back to the quote, and you can send them all 3 options, and it'll, that way they can make a decision as to which one of those that they want to use. To that point, with everything going on this year with MACRA, you want to make sure that you remember anybody that was eligible for Medicare prior to January 1st of this year, they still can get the Plan F. And actually, in many cases, if let's say they turned 65 2 years ago, but they continue to work, and this month they're retiring, and so they get that guarantee issue period based on the fact that they're retiring and it's their first time in Part B. Because they were eligible for Medicare prior to January this year, if they want guarantee issue, they actually would have to choose the Plan F. So that's been confusing people this year with some of the changes that were going on. But remember, that Plan F is actually not going away, and in many cases, actually, that is what the people have to choose if they're going guarantee issue. So just be aware of that. But you can compare any different type of similar plans next to each other and use that to email people. Next thing I want to show you is the Medicare Advantage. If you wanted to see really all of the actual benefits of the Advantage plans, this is the best place to do it. This will not let you add in drugs or do a specific profile for anybody. But if you wanted to just simply see the benefits side by side, the CSG tool is what you would want to look at. Okay, so all you have to do is go up to the top, and you can easily switch over to any of the other products. The Medicare Advantage section is where you would also do PDPs or special needs plans. So if you wanted to see the drug plans or dual or chronic plans, you would do that all within the Medicare Advantage tab. Okay. Make sure that you always have the right county selected. Sometimes the zip codes are within 2 counties. You want to make sure you switch the county to the one that you're actually looking at. One, so it's correct, but two, if you keep both counties, it will show you 2 different versions of each of the plans. So just something to be aware of. If you wanted to only see PPOs, you could do that within the filter, right? So that'll let you do that. Otherwise, you're going to hit Get Quote. Just like the supplements, they're going to show up with all the plans listed in price order. Obviously, because it's Medicare Advantage, there's going to be a lot of zero premiums. So if you don't know necessarily what plans you're looking at, you're going to have to do a little bit of trial and error to see which one fits what you're looking for. One thing to be sure that you're looking at when you're using this tool is drug deductible, where it says drug coverage not available. They're an MA only plan, so there's no drug plan built into that. So just be aware, because sometimes they're going to show up looking like they're really one of the better benefit plans. If they don't have some type of creditable coverage that allows them to use an MA only plan, you can't sell them that. So just be aware when you're doing the quote here. If you wanted to see these plans side by side, just like we did earlier, you would click the name of it, and it's going to pop them over into compare quotes. Because this is an Advantage plan versus a supplement, there's a lot more difference in benefits all the way down through the plan. So I think this is a lot more helpful in that regard because you can see everything side by side. Now, it's going to automatically default to what they think the most looked at benefits are, okay? If you wanted to see everything the plans offer, you click Show All Plan Details, and that will fill in really kind of everything that they do. So everything from acupuncture to chiropractic, inpatient, doctor visits, right? It's got everything side by side. Now, as I said earlier, the CSG quoting tool will show everything that we have available. So even if you don't have, let's say, Humana or Aetna yet, if you see a plan there that is what your client needs or what you think you're going to need, you could still see the benefits here and then call over to IAMS and let them know that you need to get contracted for that. So once you have all the benefits worked out as you're doing your phone calls, let's say you get to the point where the person wants to enroll, where they want to see what their cost is going to be, where they want to know if their doctor is in the network, everything like that. That's where you would jump over into the other tool, which is the Connect for Medicare tool. So the web address for that is connect4medicare.com. That will take you to this page. Okay. If you already have your login for that, you're going to go to the 2020 site. If you don't have your login or you're not sure, you can fill in this information box here, and that'll send an alert over to us, and we'll send you over your login information. Okay? Anything that you're contracted with IAMS that's available on the site will automatically show up for you within the tool. Every day we have to upload exactly who's contracted and appointed to sell what products in what states. So anything that you're appointed for, any state that you're appointed for, should show up there for you. Okay, so we're going to jump right into the site. This is where you would log in as the agent. Okay, what we're looking at first is what you would see as the agent, right? This is the agent portal. Okay, for the sake of the test, Kevin Shields is the agent for this. So you're going to see his name. That's where all your information would be as the agent, okay? The first thing you're always going to see is the agent dashboard. Really, this is just to give you an update on what you've sold, or if you have an open task or alert that you sent yourself, that would show up within the dashboard for you. okay? You can immediately go into a quote or an application if you wanted to, using the Send Quick Quote or Start New Enrollment. But for the most part, anytime you want to use this tool, you're going to want to go into Start Consultation. Starting the consultation will allow the system to save that client's information for you. The whole idea behind this is that, number one, especially in a time like this, you don't have to see the person to do the enrollment, but also when you got to go next year and AEP rolls around again, you can have all your clients' information already saved in here. You don't have to re-enter any of their age, name, date of birth, address, drug information. All of that is saved here for you. So what you're going to do then next year, let's say, in our area of the world, Aetna is notorious for changing the plan slightly each year and offering a new one. So rather than you having to get all new applications for all of the people that you might have on that block of business where there's a new plan that's better, you could have all the client's information saved in here, call them, and just do the application over the phone without ever having to see them, fill out new forms, go through the whole presentation process. This would just save you all that time. So when you're filling this out, I'm going to use myself, 1950. Anything that you enter in here will automatically transfer over to the application, so you don't have to worry about filling out anything twice. Once you filled out the profile information, you're not going to want to click this Send Access to Consumer Site button. What that does, if you use that, is essentially takes the quote out of your hands and sends it over to the client to be able to complete themselves. So really when you would use that is if you're talking to somebody and they didn't want to necessarily go through a presentation right then, or they just said, send me some information, or I have to think about it. You could click this button, send them the consumer site, and then if they use that from the email that you sent them through here and they enrolled, even if you never spoke to them, you would still get credit on the case. You would be the agent of record and you would get paid. Okay? So that's what that button is for. If you're continuing with the enrollment yourself, or while you're speaking to them, you're going to click continue. Anytime you want to jump ahead, you can either click continue or you can click any of the tabs that we're going to work on and you can jump automatically over to that. Okay, so if you're doing a new plan, you're probably just going to continue. But if you were coming back and looking through an old profile that you've done and you didn't want to see all these different things every time, you could jump right to the plan comparison when you wanted to do it. So first thing you have to do, and this was one of the areas this year where some of the agents had trouble, is you want to make sure you get the scope of appointment done prior to doing the presentation. Now, it seems obvious because you have to do that really anytime you do a sale. But what happened a lot of times was I had agents who did their applications and then called me and said, okay, I submitted all my apps. I have to go back and do the scopes now. Well, in that case, you don't want to do it electronically. Everything that you do through here is timestamped and sent over. So if you submit the scopes after you did the apps, they're going to be able to see that you didn't get the scope ahead of time. So if you're going to do a scope of appointment through here, you want to make sure that you get that completely filled out by both the client and yourself prior to doing the sale. If you have a paper scope already and you want to upload it here, you can do that by clicking this upload button and just pulling the file from your computer. Okay? If you don't want to do that and you want to do the emailed scope of appointment, I'm going to walk you through exactly how that looks. Put their email address in, click email SOA, and it's going to go to the client. So this would be what the client looks like, or the email they get looks like. See, it's going to say your name as the agent. It'll have a little pre-filled email with your information again. They're going to click complete scope of appointment. It's going to look just like a paper scope does. Okay. Nice thing about this is all they have to do is click the product that they want to use, put their first and last name, and then do the signature. which the signature is only this checkbox at the bottom. That's it. Product, first name, last name, signature. Once they click submit, they're done the scope of appointment, okay? So once they do that, within the profile, right? So let's say you were here talking to the person as you sent the scope, walked them through the email that they were going to get, and they did the scope of appointment. You can refresh the page, and now you can see that that scope is done by or submitted by the client. Here's the other area where some people slipped up this year. Just like a paper scope, the client has to sign it, but so do you. So just seeing this submitted by the client does not mean it's done yet. You have to do your part as the agent. All you have to do to finish that is click this awaiting to be submitted, and then fill out like you normally would the bottom of that scope page. You only have to do the asterisk. It's going to say all of the same information that you would normally have to fill out. And I wanted to do this real time as we were talking so you could see really how quick and easy it is. Okay, so this checkbox is your signature. You're going to hit submit. Now that scope is complete. You can see now at the top of the page, it shows you that that is submitted, and it gives you a confirmation number. Sometimes when you're doing the application electronically, they'll ask you for that scope of appointment number. You can always come back here and get that, but if you know you're going to be continuing directly over to the application, I tell people you usually want to either write that down or copy and paste that somewhere where you can save it. If you want to see and save a copy of the scope, you click the link on that confirmation number, and it'll download that here for you. Save that scope so you can keep it for your records. Okay. You can use this scope even if you're not necessarily doing the application through here. You can still use the electronic scope of appointment through here, and it is valid and will save for you. Okay. Once you have that scope completed, you're going to hit continue to move to the next tab. Now, this Connect for Medicare system is an actual online enrollment tool, but what it is, even more importantly, I feel like, is a real actual quote system for them so they can know relatively what they're going to be paying throughout the year, not just the premium, okay? And the way that they figure that out is three pieces. The total cost for the year is the premium, the drugs, which are going to be exact, right? The premium and the drugs will be a known cost that we'll input here, and then the medical cost. In order to estimate the medical cost, they're going to use the information that you put here in this health section. So they have algorithms built in based on where you live, your age, and your health status that's going to approximate how often and how you are using the plan. So the older you input and the worse health that you input, they're going to assume more doctor visits, more hospitalizations, right? The cost is going to go up. I always tell people, unless you know somebody is really sick, honestly, I almost always choose that good health. I think it overestimates a little bit. Better to be safe than sorry. But I would not choose fair or poor health unless you know that somebody really is pretty sickly and going to the doctor fairly often. Okay. So once you have that selected, you're going to continue to the next tab. If they receive Medicaid or any type of extra help, you can select that here. If you do select one of those options, when we're looking at the pricing and the plan comparison, it will automatically take that into account and lower the cost of the drugs and premium where allowable based on the extra help that they qualify for. Okay? So for the sake of this example, we're going to choose uncertain. Okay. This site is built by the same people that build Medicare.gov. So if some of this looks familiar to you, it's because it's actually made by the same exact people. Okay. And the other thing is, just like I'm going in here right now and doing an example for you to look at, you can go in and test it and play through the system yourself as well. This is live, so you can't get all the way to the end of the application and hit submit. But you can get all the way to that point and get yourself comfortable with using it. So when you do finally talk to the people over the phone, you're going to know exactly what you're looking at and tell them where to click and what to do. Okay? So next thing we want to do here is add in their drugs. I'm going to do just like Medicare.gov. You start typing in the word, it's going to find that drug for you, so you don't have to have it spelled perfectly. It'll pre-fill the dosage and quantity for you. You want to make sure you get this information when you're talking to people, but if you don't have it, it will choose the most common dosage and quantity for you to use. Add drug, it's going to put it on the drug list over here on the side. I don't know that there's a limit to the number of drugs that you can put in, but I think the most I've ever done on here was 22 different medications. So I have not reached the limit yet, but make sure you put in all that in here so you can give the person as close as possible to the actual cost that they're going to pay. Now, the other one I like to show people is Synthroid. So Synthroid is a brand name drug. If you enter a brand, it's going to give you a heads up about that. So it'll let you, number one, verify that they actually are taking the brand name drug. Because a lot of times people will say they're taking that, but they're really taking the generic. So that'll kind of glue you in to ask if they really are using the generic or not. The other thing is that'll allow you to tell them that we can price it out using the brand name drug and then go back and look at it with the generic drug and see if you can maybe find a way to save them some money that way. Okay? So if you do want to keep the brand, you click brand name drug. If you want to switch it automatically, even if you don't know what the generic is, you can click use generic and it'll change it over to the generic drug for you. So we're going to keep it on Synthroid, add that in here. And I'm going to do a insulin injection for you as well. Okay, so we have 3 different drugs here. Let's say that's all they're taking. We're going to say drug list is complete. By the way, if you wanted to see what the cost was of the brand name versus the generic, you would put the brand name in drugs first, run the comparison, then you could go back to drugs, switch it over to the generic, and you could go back and do the comparison again. Okay? So after you add your drugs, the next thing you're going to do is pick the pharmacy. Based on the information that you input for their address, it's going to automatically jump that to the area that they're living in. But really, you can change it to whatever you want and find a different pharmacy if they're really looking for that. Okay. A little bit different than the Medicare.gov site is that you can only choose one pharmacy here instead of 2. So if you do want to see, say, CVS versus Walgreens, you would just select one of them first, look at the comparison, then come back and switch it to the other one. For the sake of what we're doing, we'll just choose CVS. Okay. So, chose the pharmacy, hit continue to the next section. Okay, we're going to keep it off the Meds Up for now. So, you can see there's Med Advantage with prescription drug plans, PDPs, MA only, or Medicare supplement. Okay. For this comparison, we'll just look through the MAPDs. You're going to see what this will do is sort everything by total cost for the year with the lowest cost first. So you can see in this case, all of the United Healthcare plans are showing up lower. Having done this before, I know that's because we put that insulin injection in and they're the lowest for that. But if you didn't necessarily know that, doing the drug comparison might alert you to the fact that United Healthcare is a better option for them in this case, even if you typically only sell, let's say, Cigna or Humana, right? So from this screen, you can look at any of the individual companies you want. You can enroll in any of the companies that you want. You can send a quote to the person, or you can do a comparison of up to 3 of them against each other, okay? One thing I like to note here, it gives you an alert at the top of the page, but just in case you miss it, you want to just be aware that all of the plans, including D-SNPs, will show up here. So you're not going to want to select the dual plan unless you're actually looking to put them in a dual plan, right? So just be aware of that before you start it. So in this example, I'm going to show you 3 different plans compared next to each other. You can do up to 3. Click Compare Now, and it'll now show you the 3 of them next to each other. Now, contrary to the CSG tool that we looked at, which showed you every single benefit that the plans offer, this is only going to really show you the basics, right? So doctor copay, skilled nursing, deductible, hospital inpatient, and the drug costs. That's all this is going to show you here, okay? I mentioned earlier how the total cost is figured. Premium, medical cost, drug cost, right? So the medical cost was an estimate based on what we input there. So you can see there's a pretty significant difference, right? $250 difference. So if you know the person's relatively healthy and they told you they only go to the doctor once or twice a year, then you could tell them, well, look, this cost is really not going to be what you're going to be paying for the year, so you want to look more at what the drug cost is only, which in this situation is saving them even more money with UnitedHealthcare, okay? If you wanted to get a full breakdown and see what those costs were based on and the cost per month, you click on View Details on any of the individual plans. It'll show you just them, and then you can see that cost estimate by month, okay? So you're going to click See Estimate by Month. That'll show you each of the drugs you input, what tier they are, what they pay initially, during the donut hole, after the donut hole, if they have prior authorization or quantity limits built in. It'll show you all of that up top. And then it will go down the bottom and show you every single cost, exactly what they pay for each drug throughout the year. Okay. If you want to do mail order, you can click Mail Order, and it'll show you that right away as well. Now we'll jump back. Also, if you ever have a question about what any of the different pieces on here mean, anywhere you see a blue question mark, if you put your mouse over that, it'll tell you what that means. Okay. Now, let's say you know you want to enroll the person in one of the plans. With UnitedHealthcare and Humana, in order to complete the application, the person has to actually physically sign with their mouth, okay? So you have to in some way either be in front of them or email them over that application electronically, okay? All of the companies besides Humana and UnitedHealthcare, you can do the submission with just a checkbox as that signature process. So when you get to the end, it's going to say, I am the person completing the plan, or I'm helping them to finish this application, okay? In terms of what's available here, pretty much all of the major companies, so UnitedHealthcare, Aetna, Cigna, Humana, Anthem, WellCare, Centene, a bunch of local companies, so like Blue Cross Blue Shield Michigan, Emblem, Connecticut, Oscar, a whole bunch of different companies are on here on the Advantage side, and then on the PDP side, some of the smaller ones are there as well, like Envision, let's say, or SilverScript, okay? Let's say they want to choose UnitedHealthcare. You're going to go to Send Quote, okay? It'll make sure you verify this information is correct. You can type in a note here if you want to change the message and choose what documents you want to send to them, okay? So let's say you just wanted to send them the summary of benefits and the star ratings. You could do that, okay? The big thing you want to note here as the agent, this code that you see, the authorization or access code, that is going to act as the verification of their identity for the clients, okay? So when you hit Send Quote, it's going to send them 2 emails. The first one will be their access code, which is this here. The second is the quote itself. So in order to get into the quote, the first thing they're going to have to do is enter that access code. Now, you as the agent will only see this code one time as you're sending the quote to them. So if you want to save this in order to help them with it, you have to copy and paste it or write it down somewhere. Most of the agents that I know that use this fairly often will save that code in their profile if they have a CRM, or they'll just have a big Excel file with the person's names and their access codes next to it, okay? So we'll hit send quick quote, and I'll show you what the client will get. You see, just like I said, they get 2 emails, access code, quote itself. So you want to tell them, click on the access code first, tells them exactly what this is, always your information at the bottom. You're going to have them write that down or copy it. Okay, and then they're going to go into the quote, which has the message that you listed and the documents, okay? They can click view quote, and the first thing it's going to ask them is that access code. So you have them paste that or type it in and hit continue. This is exactly what they would see, okay? Always, because you generated it from within your site, it's got your information, okay? And then you can see it's got exactly what you entered in here so they can see it. So their zip code, age, health status, drugs, pharmacy, and the plan that you chose, okay? If you selected 3 different plans to send them, it would show you all 3 of them next to each other. Let's say they didn't listen to you. They got this email, and then they went to click and shop all available plans. So it shows them everything, right? If they did that, even without you knowing, and enrolled in a plan, because it's through your site, you're still the agent of record, and you're paid on that case, okay? Everything is done within your portal. So let's say you're talking to somebody over the phone. They wanted to do United Healthcare. You went through everything with them, and they wanted to enroll. All they have to do from here is click Add to Cart, and then enroll. Okay. It's going to take them directly to the application. And it has all of the normal information that they would enter on a paper app. So name, date of birth, email, address. You see everything we entered before automatically transferred over with us. Emergency contact, Medicare info. Let's see if it'll let me do a fake one here. What enrollment period they're using. So in this case, we'll do new to Medicare. It's got all the different options like you would normally see. You could choose a payment method. Answer the normal questions you would answer on the application. Okay. That's it. Okay. So all they have to do, because remember, what we're looking at here is the actual client's view, right? That's all they had to do was type that information in, exactly what we just did. And then they make sure they have I am the Medicare beneficiary and click complete review, and that's going to submit that application for them. That's it. It's literally all they have to do to submit this. So we can't click that now because we're doing a test, but if they hit complete review, that would automatically go over to the company, and that's the application that's done. Okay. Anytime somebody completes an application, completes a scope, anything like that you sent out, you get alerted by email that was finished. So you know to go into your portal and just see what they chose or see that they finished it. Most of the time, you're staying on the phone with the person, so you're going to be aware ahead of time. You know, you're going to be doing it with them, right? But if you just sent this out to a bunch of people, or you send the scope out and you weren't sure, it will email you to alert you ahead of time. When you finish the application, if you're doing it with the client, it'll give you the the option to print that or save it as a PDF so you can keep a copy of it for your files. Okay. Just a couple of other things before we finish up. Within the agent portal, okay, there's two different things you want to be aware of on here. So at the bottom of every page, you have two different things. So all of the information that we entered up to this point, you can jump to that and change it at any time you need to, okay? Also, you can get to any one of the company's doctor lookup tools or pharmacy lookup tools or drug lookup tools. So there is nothing at this point that exists that allows you to just type in a doctor's name and have every single company show up for it. But this is at least the next best thing, I feel like. It's a quick link to every company's doctor lookup tool. So instead of having to have every website saved, have your login saved, and know where to click to find it, on this tool, it'll automatically take you exactly to that page of the company's website. Right, so you don't really have to know where to look. It's got them all. You can jump right to that page of their website. So that's something I use all the time because agents call in looking for doctor help. All the companies have that available for you anytime you need it. Okay? The last thing I wanted to show you is at the top of the page, next to your agent name where it says My Account. This shows you several different things. So first off, the information loaded here, you can change it, and that'll be what shows on your agent site or anytime something's sent out to the client. This is the information that's shown. Okay? If you're not sure what you have available to you, under View Selling Permissions, it will list every company and state that you have active. Okay? So that's where you would figure that out. And then the last thing, and probably one of the most important pieces here, is your personal URL agent website. Okay? This link here, which you want to always hit copy, you don't want to try and highlight it, it's a really long link, is your personal URL, your own agent website. So a couple of different ways you can use that. Number one, if you have a Facebook page or you already have a website set up or anything like that, you can add this link as a new button or a new tab or a new page and say enroll now or quote Medicare or whatever you want to do, and you can put that link there. Anytime somebody clicks on that link, regardless of if you've ever seen or spoken to them before, if they do an application, you're the agent of record and you're paid. So a lot of times what I show my agents to do is even just something as simple as on all of your new emails, create a signature for yourself. So let's just say you normally would have your name, phone number, and email. Add an extra line in there. And then you can hyperlink that to now go to your agent website. So if somebody clicked that, it goes right to your agent website where they can get started. So that's something really simple you can do right away. Add that to your signature already. And to that point, it may seem stupid, but I always like to mention this. You want to make sure on any type of email service you're using, you do have an agent signature, right, with your information on there. The number one thing that agents miss is forgetting to add that to their phones. So if you answer a lot of emails on your phone, like a lot of us do at this point, make sure you have that signature in there as well. The last thing you want to do is make it difficult for somebody to be able to get a hold of you. Okay? Now, the other thing is, if you do not have a website already set up, you can use this agent website to create one for yourself. If you want to, you can call in here to our office. You can call either myself or Rob Valencius. Okay? He's our IT guru here. And we'll walk you through exactly how you can purchase a domain and add this link to be the website for you. Okay? So for usually as little as $12 or $18 a year, you can buy a domain, and then you can link this personal URL to it, and you have an instant website for yourself. Okay? That not only allows you to put that website on any type of marketing material that you're using, but it also would allow you to create an email address using your web domain for you. So instead of being jeffpallo@gmail.com, I could be jeffpallo@palloinsurance.com or whatever you choose. Okay, that is significantly easier than anybody usually thinks that it is. And from beginning to end of the call, I can usually have that set up for you within 15 minutes. It's honestly that simple. So if you don't have something like that set up for yourself already, reach out to IAMS, reach out to us. We'd be more than happy to walk you through how to do that. Okay. Cindy, I'm going to pass this back over to you, see if there's anybody that has any questions or anything that you needed us to go over again. I'd be happy to walk through any piece of this for you.
Great, thank you. Can you hear me?
Yep.
Okay, great. Just wanted to make sure. So thank you, Jeff, for that information. That was a lot of information, but a lot of good information as well. And just so everybody knows, this is also available on IAMS's website. So if you're registered with IAMS, you can definitely log out there. We have both of those tools available for you. And I'm also here in the office at any time that anybody would need some help with this. But other than that, let's just get out there and keep, selling, keep these seniors insured during this uncertainty. I do appreciate everybody's attendance. And if you have any questions, you can definitely reach me at the 800-255-5055 and just ask for Cindy Fry. And again, Jeff, thank you so much for your time. And you all stay safe and healthy, and we'll be talking soon. Thanks again. Take care.
Thank you, Cindy.
You're welcome. Bye-bye.